Welcome to this week's episode of Soulful Release with Tendai Bbosa. This week is really special for me because we're going to be talking about something I'm very passionate about, and that's Polycystic Ovary Syndrome, which is PCOS. I'm so excited because the yin to my yang is still here. She's coming. The episodes continue with her. I love having her around. So welcome, Cookie.
Hi, Cookie. Thank you.
Thank you for having me on the show once again, Cookie. I'm so delighted that we're going to talk about your biggest specialty or your passion.
Yes, I love it. Okay, fine. I don't love it like that, but I love it. Let's just leave it at that. So, PCOS, Polycystic Ovary Syndrome. You were diagnosed with it.
Yes.
How did that go for you?
Wow. It's been actually hasn't been a year. It hasn't been a year since I've been diagnosed with Polycystic Ovary Syndrome. And I think from the time I got the diagnosis, I was quite angry because I discovered that I could have been diagnosed a long time ago, but because I didn't fit the description, as she's always saying, if you've listened to all her videos where she talks about PCOS, I didn't fit the description of a person who has PCOS. So from the time I got diagnosed, I was confused. I even thought it was a mistake at some point because I thought, no man, I've been through so many gynaes. Why didn't they pick up that it was actually PCOS? But after having so many conversations with you and you having read a lot, I mean, you've become an expert where PCOS is concerned, I've actually realized, yes, it is possible that I actually have PCOS. And I think that's where the acceptance came in, and that's how the journey started.
Because we've had a live on this before, I think you might allow me to talk about it.
Of course.
You went through 2 miscarriages,
Yes.
and both of which were unexplained. And getting your PCOS diagnosis, wasn't that like a light bulb moment? Because what we already know about PCOS is that it also causes multiple miscarriages, and getting to know that you had 2 miscarriages before, did that also contribute to your anger? Like, doctors, you didn't pick this up?
Yes.
So,
In the books.
yeah, so if I have to go back to the beginning of my journey, where fertility was concerned, after I got married and everything, and then we decided we wanted to try for a baby. The second gynae that I saw, she said to me, when she looked at my ovaries, she said to me, it almost looks like they're cysts, but they're not cysts, It's like she immediately dismissed it because
Don't fit the description. But wait, let's just talk about the description.
The description.
Me.
Okay. Yeah, you could go.
So normally it's obese women or overweight women. You have acne, you have extra facial hair or extra body hair, you have irregular periods. It's not the tall people who go to the gym and eat right. It's me who used to feast on cake for breakfast and chocolate for lunch and ice cream for dinner type. I fit that description. So a lot of women end up with no diagnosis because they don't fit the description, or they probably look like my yang.
Yeah.
So, yeah, yin, and I'm the yin, yang, yeah. Okay. So, when she said that, I knew there was something called PCOS, but I actually didn't understand, what it really was. At that time, there was very little information on PCOS. So it's not like I could have gone home and actually sat down and say, oh, the doctor mentioned something about cysts, let me Google it. I didn't do that. And that was after the first miscarriage. And then she said, no, we're just glad that you can at least fall pregnant, So
Because you should be grateful.
yeah, you should be grateful. So we're going to fix this. You're going to have your baby. That's all you need to know, pretty much. And I remember she put me on a couple of medications. And to be honest, just being on that medication was stressful because I had Mutsa, who is the pharmacist, who knows this medicine, gives this medication to patients. But now I'm the patient and I didn't understand the side effects. There were quite a number of side effects that I experienced taking that medication.
You probably understood the side effects. You just had never experienced them.
I never experienced them. Yes, that's true. I never experienced them. So in any case, this is a young couple, wonderful, pregnant. So we went on with everything, but it was still emotionally stressful. And then came the second pregnancy, excited, but being cautious because we really don't know. We don't know why we had the first miscarriage. Now the second time around, you want to do everything to avoid another miscarriage as much as you can. And then I lost the baby. And I went back to her. She still didn't have an answer for me. So I think, okay, what's going on? I don't have a diagnosis. She looks at my uterus. She looks at my ovaries. She looks at everything. Everything looks normal. Everything looked normal.
Yeah.
So why am I losing the baby? Why did I even struggle to fall pregnant the first time, And so now when I come back to now, when I got the diagnosis, that's when it really clicked to say, oh, had we known it was PCOS, we would have dealt with this much, much better, maybe. I think a part of me did feel like that. I wouldn't have gone through so much emotional turmoil, emotional loss, because I think the worst thing for me was when I spoke about the miscarriages, people were like, oh, it happens. Oh, yeah, no, it happens, especially if it's your first baby. Oh, you can have 1 or 2 miscarriages, but you'll eventually have your baby.
I'll need to stop that.
So, and I think that's another heartbreak, right?
Too many heartbreaks.
Too many heartbreaks, I know.
But that's I think that's the first part I would always remember, and that I would always refer back to not knowing. We're just going in blindly, and by the time you discover that, oh, it's actually this, you feel like you could have changed things had you known earlier.
Yeah. So how was it after your diagnosis? Did anything happen after that? Were you managing your symptoms? Any good news? Nothing? Anything?
Okay, so I think with from the time I got received the diagnosis, right?
Yeah.
I knew I had to change my lifestyle. The doctor then said to me, look, I'm going to have to put you on this regimen, glucophage. And
That's
I thought to myself,
metformin. I thought, what? Am I really going to take metformin? Because my scientific brain is saying metformin is for people who have diabetes. I don't have diabetes. I knew where he was swaying towards, but I still didn't comprehend, you know what I mean? Because I'm the patient now. But in any case, I remember we discussed the medication that, he put me on, and I had discussed it with him, and I kind of explained to him
your fears.
my fears and everything. And I remember you were like, oh no, you can manage this. So after I got the prescription with the medication that I needed to take, we discussed it. You and I discussed it, and you were telling me, look, babe, at least now we know. We have a diagnosis now, and we can work with it. And now that I think about it now, I'm glad you gave me that advice, because I came to a point of accepting it, and I knew I had to change my lifestyle. And it wasn't just about the medication. Remember, we did a gut cleanse, which we'll talk about sometime, but we did a gut cleanse, and I'm grateful that I went on that medication, and I'm grateful that I actually had you to walk with me throughout this journey.
Yin to your yang?
Yes.
My yang, yes. I've been able to manage this, the disease, and you'll get to hear more of how this turned out for the best.
Leave it at that.
That's good. So as you know, talking about PCOS or reproductive health in general, female reproductive health, is something I'm very passionate about, and I'm always helping a lot of women with this because I was diagnosed with PCOS. My best friend was diagnosed with PCOS. My sister or sisters were diagnosed with PCOS, and getting to learn that and know that I'm in the medical field, I had all these symptoms, but never did it occur to me that I had or I have the PCOS. So just going through that made me realize that there's a need to raise not only awareness but make people know, and it is our duty as medical professionals to be able to give proper and the right information out there, because there's too much information, and in most cases people are taking advantage of people. So we don't want to do that. We swore an oath that we would. What was our oath?
We are the custodians of medicine.
There we go. Well, we are that, but our oath was very long. But in a nutshell, our oath, we put people first.
Yes.
So that's why I said this episode is very special, because we will get to just talk about what PCOS is, what you need to look out for. And please bear in mind, this does not replace your doctor's advice. After you listen to this episode, don't diagnose yourself. It is not your job. It is not my job. There are doctors for that. Please go and see your doctor or your gynecologist, OBGYN, whatever we call them. But go and see them so you can get an actual diagnosis.
So, PCOS, which is Polycystic Ovary Syndrome, it's diagnosed when you have 2 out of 3 criteria from the Rotterdam criteria, right? The first being irregular periods, the second being high androgens, which can be seen by hirsutism, acne, and deepening of the voice. And because of the testosterone, you end up with weight gain and insulin resistance. And the third criteria is when you have cysts in your ovaries, polycystic ovaries, and you see a lot of cysts in the ovaries. So this diagnosis is according to the Rotterdam criteria. Mind you, this does not replace any medical advice. Speak to your doctor regarding any of the symptoms that I've mentioned.
So now that you've heard about the diagnosis and what you need to look out for in terms of the signs and symptoms of PCOS, I could not let you go without talking about the medicine just a little bit. So the first thing is metformin. Metformin is given especially when you've got PCOS and insulin resistance. While metformin is indicated for diabetes, remember PCOS does present itself as a metabolic syndrome. So because a metabolic syndrome kind of acts like diabetes, this is how you end up on metformin. The other good thing about metformin is that it also increases your chances of ovulating, which is a problem when you've got an irregular cycle or an unovulatory cycle, which means you do not ovulate. So the second thing that you get that is not very popular these days is the birth control pill. Different types of birth control pills. The reason you get birth control pills is because it masks the symptoms. Because at times with PCOS, you not only have irregular periods, you could have very regular periods, but heavy and very painful. So to help combat that, you get that. And a very small percentage does get their cycle regular from using the birth control pill. The other type of medicine you can get is medicine that stimulates your ovulation, and this is Clomid, Clomiphene. You can get Letrozole, Femara. That also helps to just jumpstart those ovaries, try to get that ovulation in, especially for women who are trying to conceive. Nowadays, things have sort of changed. Women and people are preferring more natural methods. This is why I want to talk about the adjunct therapy. So what has been discovered in research about PCOS is that we have there's a B vitamin that's lacking, and that's inositol. So there are different formulations of inositol, and it comes in 2, myo-inositol and D-chiro-inositol. I know these words are so big. However, these 2 in combination, we have them in our body. One of them is more abundant in our ovaries, and the other one is more abundant in our in our cells, in our like body cells, tissue cells, where it helps with insulin resistance. So you find very popular products in America are ovasitol. In South Africa, there's a lot of them, but I don't know which ones are very, very popular. But we've got Inofolic, we've got Intiomax, we've got, I'm just trying to remember all the products. We've got Picositol, we've got Salome, fertility capsules. All of these contain the inositol. My advice would be, if you want to go on inositol, don't just go and get inositol. Go and speak with your doctor, because then they will know which dose of inositol to give you. And lastly, I need you to add magnesium and zinc, as these help with ovulation. That's it that we have. This time the episode was a bit different because it's something I'm very passionate about and something I keep going on and on and on about. So I apologize for making the episode very long, but I hope you learned something. And if you do have these symptoms, just know you're not alone. We're all in this together, and as we get a diagnosis, we must find a way to release that pain and accept that we can deal with it. That's it on Soulful Release. Interesting, right?